Thank you all for joining us tonight. Thank you so much for joining our partner resource webinar session. We're going to go ahead and get started. So just some housekeeping. This meeting is going to be recorded. These meetings are always recorded, even if you're not able to make them. Continue to register and we will send you the recording. Participant lines will be muted, but please feel free to use the chat box. We have a pretty small crowd tonight, so hopefully we can get some interaction, some conversation going. And if you need closed captioning, there is a button available for you on Zoom. And if you need help setting that up, you can just chat me. Alrighty, and for tonight's agenda, I am Jasmine Martinez, and I work at Virginia Department of Health in the Office of Health Equity, helping the Virginia Partners in Prayer and Prevention Initiative. And tonight we are joined by Dr. Anika Hines for the second time now, and I'm so excited that she's going to share some resources from American Heart Association, as well as some information as we prepare for American Heart Health Month, which I know is super busy for them. So I'm going to go ahead and pass it to you so we can hear all about it.
Well, good evening, everyone. I'm just going to share my screen, so just give me 1 second. All right, can you all see my screen? Thumbs up.
It's loading for us. All right, we can see it.
Perfect. Well, it is so great to be here. Thank you so much for the invitation. Thank you so much for the opportunity to speak to the Department of Health again, and especially the Partners in Prayer and Prevention. It is so exciting. It's an exciting time for us at the AHA. As you know, American Heart Month is next month, and I can't wait to tell you about the work that we have been doing and the work that we have planned to do, and the opportunities for you to become involved next month and future months. So again, I'm Dr. Anika Hines, and I'm the president of the board of the American Heart Association of Central Virginia, which covers a large area all the way up from Charlottesville to Richmond and all the way down, I think, out a little bit west of here. But it's a huge part of Central Virginia that we're serving. And I wanted to just, for all of you who don't know, the American Heart Association is a relentless force for a world of longer and healthier lives, with a vision to advance health and hope for everyone, everywhere. So it's my pleasure to talk to you about the work that we have been doing. So, you know, as a cardiovascular researcher, which is my day job, I have the opportunity to research really cardiovascular health and specifically hypertension, which is what we think of as the silent killer. Hypertension is a risk factor for a number of other different conditions, including the development of cardiovascular disease, chronic kidney disease. There has, interactions with diabetes. So hypertension is really a major issue. About 50% of individuals in the United States have high blood pressure, and the proportion's a little bit higher for Black people in particular. About 60% of African Americans in this country have blood pressure. So it's really important, as a part of our kind of strategic plan that includes access to care, quality of care, risk factor management, including hypertension, as well as, CPR training. We focus on those areas in implementation for our Central Virginia area. So this first slide just shows that there have been a number of blood pressure stations that continue to grow across Central Virginia. One key point in managing hypertension is to know your numbers. And so I'm going to encourage everyone on the call, because I love to say it whenever I have the opportunity, to definitely know what your blood pressure is. Know whether or not you're in the elevated range or in the normal range, which would be 120 over 80. Less than that, a little bit above that would be considered elevated, and up to 130 over 80 or higher would be actually considered high blood pressure. So we want to keep that in check. And in towards that goal, these are just some of the photos from a few of the community activities that we've had recently. For example, we have launched blood pressure stations in three YMCA's in the area. We have revamped the library resources, and our new libraries have Heart Brand and the updated blood pressure level charts, which include the updated measures. High blood pressure used to be defined at 140 over 90, and now it's been actually lowered to 130 over 80. So again, make sure that we are checking our numbers there. There are additional blood pressure stations at St. James Baptist Church, and we provided cuffs to the Health Brigade. And we also held a CPR training at Atlantic Union, Capitol Square, Genworth, and Henrico County Schools, holding also a gratitude event at CoStar, just a numerous number of activities. We've been very busy with regards to the Central Virginia area and managing blood pressure and even thinking about CPR, but we'll talk about the CPR portion a little bit later. Starting now. So here we have some pictures from our CPR and AD training and CPR kiosk launches. I probably don't have to tell this audience, it's really important that everyone learn CPR. It's a critical life-saving skill. About 350,000 people have a cardiac arrest outside of the hospital every year, and unfortunately, only about 10% survive those. So if you can imagine, that means that we need many, many more hands in the community where we live, where we work, where we play, where we pray, who know how to execute those life-saving skills that can ultimately save a life. So in that sense, we have been working to not only teach people CPR and AED training in the formal setting, but there has been a CPR kiosk which launched the very first one right here in Virginia. It was first positioned at the market at 25th and most recently moved to the VCU Commons. So students there, community members there will have the opportunity to learn hands-only CPR, which is an effective way to maintain and kind of keep a life going while we're waiting on emergency help. Using a kiosk. So basically, there's a mannequin that you can practice on. It takes you through all of the steps, teaching you hand placement, the depth of the compressions, as well as the frequency of compressions to our also famous staying alive theme, in order to ensure that you are kind of delivering those compressions in the manner that will lead to saving a life. And so that right now is at the VCU Commons. You can see some of the pictures of the launch from the market at 25th, but you might also hear about a VCU student who saved a life using her CPR skills that she learned in the high school setting before coming to VCU, and actually had to use those skills in real time after breakfast at a diner where she actually saved an individual's life. So it's really important, as a part of our Nation of Lifesavers campaign, we're hoping that at least one person in every household learns the critical skills of CPR, and that includes, even learning hands-only CPR, which is fairly easy to learn. Someone as young as 9 years old can learn it. It's really important. I wanted to say also that it's a critical skill that is easy to learn and not easily forgotten. So once you learn it, it's really easy to remember that and pull those skills out when you need to have it. So our next slide, we are talking about Virginia Heart Advocacy Day, which is actually January 22nd, 2026. And this is our opportunity to really get involved with policy in Virginia around heart health issues. And this year, we're really focusing on healthy school meals for all and advocating for a healthy Virginia. I probably don't have to tell anyone here, but school lunch is imperative for so many students. Many students in the US and especially in this area in Virginia suffer from food insecurity. And so sometimes that meal at school may be one of the only meals of the day for some kids. So it's a real opportunity for us to start thinking about our heart health early in life. It's never too early to start thinking about heart health, and providing nutritious food is one of those ways. And so here you have a QR code. You can actually scan that to become involved in Virginia Heart Advocacy Day. It's an opportunity to get face to face with our legislators, to really talk to them and tell the stories that move people in terms of thinking about policies that will improve the health and well-being of everyone here in our state. Just to give you a few more facts, so 1 in 8 American children are food insecure. This means that they don't always know where their next meal is coming from. And during the pandemic, Congress provided waivers to programs to implement healthy school meals for all, regardless of poverty levels in the area. So that removed some of the barriers like stigma, or, for example, there's a certain sort of stigma or sometimes isolation related to receiving free meals. In order to overcome that barrier, there was a sort of full coverage in terms of, regardless of poverty level, access to healthy foods. So studies have shown that this program was liked in schools, students, and families. However, it ended in 2022. So we are really looking forward to the opportunity to re-implement these actions, which will help students not only educationally, but also in terms of their health. Things like memory retention, classroom behavior, and overall school performance are all connected to food insecurity. So schools, in addition, must meet the nutritional guidelines, and eating a school meal is a nutritious meal. So we have the opportunity here to advocate for this policy with our state legislators and hopefully move them to pass this work in order to offer that access to all. I'm going to talk a little bit now about opportunities even for the young among us. Again, I said before that it's never too early to start talking about heart health. And so the Teen of Impact is actually a program that is about creating opportunities for good heart health in all communities across the nation where heart disease remains the number one killer. During this 9-week competition, young people are actually engaged in a way that allows them to inspire them, be inspired, and to inspire others to take action in their communities. They can do this by, teaching hands-only CPR, raising money for life-saving research, and even advocating for the well-being of all people. And it matters because heart disease and stroke can affect anyone at any age. So this Teen of Impact, nominee program actually engages our young people who are the next generation of sort of heart health advocates in a really meaningful way. I had the opportunity to spend some time with our two Teen Impact Award campaign winners from last year. Just phenomenal students who are on their way to doing great things in the world. Everything from medicine to being engaged in filmmaking. It's a real opportunity for outreach to young people and to get them moving in the community. The campaign dates are from February 6th to 2026 to April 9th, 2026. And if you are interested, you can go to the Teen of Impact Award if you know a young person who might be interested. And the contact is Whitney Jones here at Heart at Central Virginia. Likewise, there is a Central Virginia Women of Impact Award, and this is really important because this is an inclusive initiative to drive awareness and raise funds for women's heart health. Now, many people don't know that cardiovascular disease is actually the leading cause of death of women, more than all of the cancers combined. So, heart health is really, a really important opportunity for women to become engaged and raise awareness. Sometimes, kind of cardiac arrests manifest or heart attacks manifest differently for women. So this is a point of opportunity to raise awareness and to really increase fundraising for research that not only uh, seeks to find solutions and treatments for heart disease alone, but also some of those specialized treatments that might be required to address the unique needs of various segments of our population that are affected by cardiovascular disease. So again, these dates run from February 6th to April 9th. And the Women of Impact, similar to the Teen of Impact, would be working in their networks to form an impact team, to set a goal, explore fundraising opportunities, and to talk about have a direct impact on women's health through life-saving research and through advocacy as well. So if you have more information, again, Whitney Jones is that connection. The Leaders of Impact is meant to be a group of change makers across the country who are nominated in an initiative that is to spotlight heart disease as the number one killer and drives equitable health for all. Together, nominees embark on a 7-week blind competition, bringing together champions from within their networks to form an impact team similar to the Women of Impact, set a goal and explore fundraising opportunities and have a direct impact. So all three of these programs, the one for teens, the one for women, as well as for leaders, are all focusing on the activities that we can do with regards to fundraising, with regards to advocacy, even with regards to education in order to improve, heart health and awareness as well as research opportunities. At the end of the campaign, one nominee will be named their local Leaders of Impact winner, and additionally, the nominee who makes the biggest impact across the country will be named the National Leaders of Impact Award winner. And so these dates are as below. The upcoming dates are September 17th, October 12th, November 4th, as well as November 10th. So you can scan there to make a nomination. One of my most favorite events of the year is the Central Virginia Go Red for Women Luncheon, which this year is going to be held on February 13th at the Richmond Marriott downtown. And as a part of that, there is a silent auction for the personality. And so the personality auction is a really fun and exciting time where you have individuals who have donated, local personalities have donated purses with items that are filled with a theme. So um, individuals can donate a personality by participating, sending your full name, phone number, and email to, again, Whitney Jones. There's a high resolution headshot and 2, 3 sentences describing what your personality is with regards to the items that would be in your purse. Your purse will be displayed at the luncheon, and then it's a really fun time at the luncheon where individuals bid on these auction items and really kind of bring home some fun gifts. So it's an opportunity again to donate and to be involved in a sort of in the women's luncheon with a sort of purse theme. So I'm going to talk a little bit now. I think everyone's probably aware of the typical Central Virginia event volunteer opportunities, which are the Heart Ball and Go Red for Women. The contact is Jennifer Hamlet, the Heart Walk, Savannah O'Brien at Heart. And so the local events really make an impact on the local area. When volunteering for the AHA, you get to learn about our programs and events while serving our community and meeting local survivors. And the survivors are probably my favorite part of particularly the heart walk in particular, where they get to go through a special sort of finish line and we cheer them on because it's really an important thing. We celebrate every single life that survives a heart attack or cardiac arrest or a heart disease. And so we're really happy and it's really meaningful to us to see that, the American Heart Association is making impact through research and programming and education that has over time decreased rates of stroke mortality of heart disease mortality as well. And we hope to move forward with a healthier world free of heart disease and stroke. Again, these are just opportunities. I have participated in the ball and the Go Ref Women and the Heart Walk for several years. It's some of the most fun that you're going to have. The walk is really an opportunity for communities to come around. You find teams that form for different organizations. It could be your church, it could be your local community group, it could be just a group of friends, it could be a family walking with a survivor. So there are really opportunities for everyone to get engaged there in particular. So the 2026 Heart Walk, where I will probably appear again, we teach hands-only CPR once again under the CPR tent at the Heart Walk. So I hope to see you there. But it is the largest community-facing initiative of the AHA. And this year's Heart Walk will take place on Saturday, October 17th, 2026. And if you have questions, you can reach Bobby Hall or Josh Epps at heart.org. And it really matters because here we are again raising funds and raising awareness, teaching important skills, and there are opportunities for to receive nice giveaways and whatnot. It's just a fun time for the community to come together and to really coalesce around this shared mission of improving health for everyone, making longer, healthier lives. And one of the most important ways that you can become engaged, it's pretty low risk, is to just follow us and to share. To share if you participate in heart events or if you are interested in more of the work that we're doing, we have our various social media accounts where you can find, you see some of the pictures here from some of the events that I already mentioned, be it the Heart Walk or CPR trainings or even the Go Red luncheon. But it's a really fun time and it's a really great organization to be a part of in terms of making an impact to improve heart health, which is the leading cause of death in the U.S. So I don't really have many more slides today, but I'm happy to answer any questions you all might have just about the work that we're doing or other questions about heart disease or anything that might be helpful to this group.
Yeah, thank you so much for that and sharing all of the initiatives that y'all have going on. If we have any questions, please feel free to come off mute or type them in the chat box. And I meant to mention, we also have Miss Angela Taylor on the call, who is also with American Heart Association. Um, I know she put in the chat if anyone is interested in a blood pressure station with their organization, so please reach out. But yeah, please come off mute. We have plenty of time. I do want to say I would love to send out those slides so everyone can have links and access to the information and um, different events going on, as well as y'all's emails.
Yeah, absolutely. And we love to have support from organizations or individuals. It's really, heart disease really is everyone's business. I think if we went around the call, everyone could probably identify someone in their family or in their network who has been affected by heart disease. I'm passionate about this. My own mother passed of a heart attack about 7 years ago, even before I was doing my research and the work that I'm doing. When I embarked on my journey as a researcher, I had no idea that my family would be so personally affected. But again, knowing that heart disease is the leading cause of death in the US, many, many people have been affected and will be affected. And we're really trying to take the time and energy to just do what we can, even if it means just learning hands-only CPR, or it is, engaging in the heart walk for your own fitness, or taking care of your own heart. Consider walking or movement or, thinking about incorporating more fruits and veggies into your diet. All of those things are part of the mission, are important contributions to the work that we're collectively doing so that we all can have longer and healthier lives.
And I will just jump on to say, good job, Dr. Hines, that you did a great job.
Thank you.
But in addition to like the blood pressure stations, we're also doing a lot of work in the maternal health space as well. So really working with our doulas and organizations that are working in with our pregnant women and our moms out there, because we know preeclampsia is a disease that can form when you're pregnant. And so, as someone who's coming off of maternity leave, I was diagnosed with severe preeclampsia and had to deliver my son early. And so, just being able to provide a resource such as a blood pressure monitor to an individual like that really can save a life. And so, that's what we're really trying to do. So, again, I just echo the sentiment. If your organization is interested in having a blood pressure station put up, please reach out to me, and let's have a conversation, as well as any resources related to blood pressure, cholesterol, heart attack, stroke, you name it. And since Heart Month is coming up next month, I will send to you, Jasmine, just some resources that we've already put together that you can send out to this group that have some of that information in it. And just always know that you can rely on us as a resource in the community, for any of your heart health needs, stroke needs. We have a lot of information on heart.org. And if you have you need a point of contact in Northern Virginia, I will send that as well, because we have different community impact directors in different parts of the state. So Northern Virginia, Hampton Roads, Southwest, I will give those contacts to Jasmine for her to send them out to this group as well.
Perfect.
Thank you so much, Angela, because we again want to engage in with everyone to have the opportunity to engage with their local chapters
Right.
and local movements, because collectively we are working together to address heart disease, and every community needs the resources. So thank you for that, Angela.
Absolutely. Absolutely.
All right, did we have any other questions or comments? I know I wanted to ask, as someone who's worked in outreach, I know it's pretty difficult to turn that awareness part into action. And I know this is a part of y'all's daily lives at this point, but any advice or words for anyone that's, not in this type of field at all, but again, it's so connected to all of us and it is happening to a lot of us, something that we can do just in our regular lives to turn awareness into action for family, friends, coworkers.
Yeah, absolutely. Well, I mean, it starts with us, right? And
Mhm.
so one thing that we can do without even leaving our homes is to think about our own health. And there are a number of factors that are in play, and even engaging with your practitioners about your blood pressure, for example, for your about your glucose levels, thinking about your stress and sleep. Just taking care of yourself is step one in this process because we can't really help other people unless we're taking care of ourselves. So the simplest thing is let me pay more attention to my own blood pressure. Let me at least know what my blood pressure is so that I know if I need to be monitoring my salt intake, if I need to go talk to my physician about something. So that's step one. Step two is what you know, the facts that you know you can share with your loved ones, the people in your networks. It doesn't necessarily have to be coming, joining a platform like this to give a talk about, these opportunities or the sort of dangers of high blood pressure. It could be as simple as you knowing your numbers and also encouraging your family members to know what their blood pressure is. And, getting a kind of blood pressure monitor that you can keep at home to monitor that, learning how to properly measure your blood pressure, and then also doing things like learning hands-only CPR so that in the
Mhm.
event, and I hope that no one has to encounter this, but, the likelihood that it just might happen, given that we are in the situation that someone is having a cardiac arrest, we'll know what to do. We'll know how to check this for consciousness. We'll know how to, where maybe we'll know where the AED is in our building. And the American Heart Association has also been working with community organizations to develop cardiac emergency response plans, which was a bill that we really pushed with regards to legislation last year. And so we really want every organization, churches, community organizations to at least have a plan in place. So if a cardiac arrest happens in your facility, if you have a facility, if you're a community organization, somebody knows what to do. Of course, we know to dial 911. But for example, if we have an AED, where might it be? If there's a particular person who knows CPR, or there are multiple people who know CPR, what is that chain of command that's happening? Because we're really talking about minutes with regards to saving a life. And so if someone knows how to do CPR, they kind of facilitate that chain of survival, right? So when we're waiting for the ambulance to come, which might, depending on where we live, if we live in a rural area, it might take longer. If we are living in a high kind of traffic area, it might take longer, depending on, whether or not the ambulance can get through. That's really life-saving time that can mean the difference between someone surviving and someone not surviving. So what can we do just to continue to keep that heart pumping while we're waiting for other people? But, having that kind of knowledge of what do I do in the event that something happens. A lot of times people are walking around or waiting around for someone else to act because sometimes people are afraid, or there's kind of a lack of knowledge of CPR, or there's a fear about doing it. People fear repercussions for it. And I will say that studies have come out that have shown that Black people in particular and other marginalized groups are less likely to receive bystander CPR relative to others. So that's really important. Women are less likely to receive bystander CPR and survive cardiac arrest than men are. So if we really destigmatize and reduce the fear around administering CPR, and that happens by people having knowledge and the skills to do so, and we're doing that hopefully by, this kiosk that we've put into the community that you can literally in 5 minutes learn just kind of the very essential parts of how to do hands-on CPR well, so that if needed to, you could do that in the event that someone is having a cardiac arrest. So first thing is take care of yourself. Second thing is spread the information in your networks. And the third thing is learn simple skills when you can. And it's hands-on CPR at this kiosk is free to learn. So it's not like you have to pay for a long certification. You don't have to sit in a room for half a day. And still you can have some skills that you can try on that you can use rather on someone you can try at the kiosk, in terms of, making sure that you're practicing it correctly. But you can learn the skills that you need in order to help someone to survive in a very effective way. And so those are three things that you can do, and I'm happy to offer more. But participating in the Heart Walk, connecting in communities. The more we are connected in our communities and caring for each other, I think the more of a sort of impetus to act when the time comes we also have. So that's really building camaraderie, building community, building our capacity to kind of use our skills, but also building that connectedness, which is really important for survival and actually supports heart health too.
Yep.
That was beautifully said.
Thank you.
Yeah, do we have any other questions or comments? I see a lot of thank yous, and Ms. Taylor already said that she would share some more point of contacts across the Commonwealth. And I'm sure that they are having events all over the place as well for February. Um, yeah, I don't see any other questions in the chat. I'm gonna just bring up my last slides and heartfelt thank you to Dr. Hines and also Angela for joining us tonight and sharing with us. Um, I know for sure I will be pushing those events that you shared on our website, through our newsletter, and then hopefully if I can show up, I'm gonna show up. And
Thank you so much. And if you all have your organizations or you have requests, we are always happy to supply resources. And Angela already said that she would share some of our kind of web resources or electronic resources at the end of the call. But thank you so much for having us. It's been a pleasure.
yeah,
Yeah, thank you. Thank you guys so much. And I will send over that information as well as some other things that I find interested. But again, heart.org really has a lot of information. If there's a particular topic that you want, we have a Healthy Sunday series that we're starting to kick up with a lot of our faith-based organizations. So if anyone is interested in more information about that and how we can work together with that, feel free to reach out to me. I'm happy to have a conversation and see how we can get things going in the community.
that's awesome. Thank you all so much for tonight and also just everything that you do. And thank you guys for joining us tonight. I do have a QR code on the screen, just a post-webinar survey to let us know how you all are enjoying these calls, what else you want to hear more about. But other than that, thank you all for joining us, and please have a wonderful evening and a great rest of your week.
Thank you. Take
Thank
care.
you. Take care.